So welcome. In this session, we'll be looking at scapulohumeral muscles. Give me a minute. We'll be looking at scapulohumeral muscles, and they are usually 6 in number. We have deltoid, teres major, and 4 rotator cuff muscles, namely supraspinatus, infraspinatus, teres minor, and subscapularis muscle. Welcome all. My name is Morris Munyiri, and I'll be your daktari. Let's start with the deltoid muscle. Now, the deltoid muscle arises from the anterior border, anterior border and upper surface of the lateral 1/3 of the clavicle, also from the whole of the lateral border of acromion, and also from the inferior lip of the crest of the scapular spine. Okay. Then on the lateral border of the acromion, it presents 4 ridges. Okay. And from them, 4 fibrous septa usually pass down into the muscle. Now, it usually insert into the deltoid tuberosity, okay, on the lateral aspect of the humerus, okay. And the deltoid tuberosity is a V-shaped ridge, is a V-shaped tuberosity, okay. Remember, this is on the lateral aspect of humerus. Now, on the medial aspect of humerus, directly on the medial aspect, that is where your coracobrachialis muscle will insert. Please remember the 10 anatomical events that occur at the point of insertion of coracobrachialis muscle. Please look at that now. Okay. Now, from the edge, from the ridge and the rims of the V-shaped fibrous, from the V, 3 fibrous septa usually pass upwards between the 4 septa from the acromion. I will show you this in an image. Then the space between the septa, these 3 septa are usually filled with the fleshy muscle fibers, which are attached to the contiguous septa. Okay. Now, it has 3 parts. Okay. Deltoid is like a 3-in-1 muscle. It has a central part or the middle part, anterior and posterior part. Now, the anterior and posterior parts are unipinnate. Okay. But the middle part or the central part is multipinnate. And note this, the multipinnate central part, it contracts slowly, slow contracting, okay, diminished range of contraction, but increased force of pull. Whereas the anterior and posterior fibers, which are unipinnate, they usually they have an increased range of contraction, but their range of movement is greater, that is, but the force of their pull is less. Okay. Now, the deltoid muscle is supplied by the axillary nerve. What are the actions of the muscle? Now, working with the supraspinatus, deltoid abducts the arm by the multipinnate acromial fiber. So the central fibers or the acromial fibers are the one which abduct the arm. Now, the anterior fibers or the clavicular part usually in conjunction with the pectoralis major, they assist in flexing and medially rotating the arm. Okay. Then the posterior fibers or the scapular fibers assist the latissimus dorsi in extending the arm and also act as lateral rotator of the arm. So that is why I've said it is like a 3-in-1 muscle, a 3-in-1. Okay. In this way, you can see the multipinnate central part is for abduction. The clavicular part or the acromial fibers are for flexing and medially rotating, whereas the scapular part or the posterior fibers, they extend the arm and lateral rotators. Now, remember, it is a site for intramuscular injection. Like, remember when people are being given the COVID-19 injection, where it was done into the deltoid muscle, but where? Now, the site for intramuscular injection into the deltoid is on the lateral aspect, on the bulge of the shoulder, and it should be not more than 4 centimeters below the lower border of acromion. So, as a medic, you should first identify the lower border of acromion on the patient's shoulder. Then, between that acromion, you should not go, if this is a deltoid muscle here, you should not go more than 4 centimeters, not more than 4 centimeters below. Okay, this you can now inject anywhere here. Why should you go 4 centimeters? Because there is risk of injury to the anterior branch of axillary nerve, okay, which usually curl forwards around the back of the humerus, some 5 centimeters below the acromion. So you don't want to injure by injecting there. Okay. So let's continue. Now, here it is. You can see it has 3 parts. This is the clavicular part here, or the anterior fibers. These are the multipinate middle fibers, and these are the posterior fibers. You can see it is inserted here. This is the deltoid tuberosity would be somewhere there. Here it is. You can see this is the origin of the posterior fibers, the crest of the spine of scapula. These are the scapular fibers of the posterior fibers. Then these are the multipinate arising from the lateral border of lateral margin of acromion. Then the clavicular fibers or the anterior fibers arising from the lateral 1/3 of the clavicle, the anterior part. Remember, trapezius is inserted also here, somewhere there, along the same line, but anteriorly. Okay. Please remember how they are related. The origin and insertion of trapezius arms. The origin of deltoid is somewhat related to the insertion of trapezius muscle. Please look at that. Now, let's go to the second muscle, teres major. Arises on an oval area on the dorsal surface of the inferior angle of scapula to be inserted into the medial lip of the intratubercular sulcus of humerus. The intratubercular sulcus is also known as the bicipital groove. Okay. Now, the flat tendon of the latissimus dorsi usually wind around its lower border and comes to lie in front of the upper part of the muscle at the insertion. Remember, as it winds around the lower border of teres major, it usually forms the posterior axillary fold. Now, teres major is supplied by the lower subscapular nerve from the posterior cord of, is it the posterior? Yes, from the posterior cord of brachial plexus. Okay. Which, and the nerve enters the anterior surface of the muscle. What are the actions of teres major? They assist the other short muscles in steadying the upper end of humerus in the movements of the shoulder joint, but it is not a rotator cuff. Please remember that. Acting alone, it is an adductor and a medial rotator of the humerus, and it also helps in the extending of a flexed arm. Okay. Now, together with the teres minor, they usually hold down the upper end of humerus as the deltoid pulls up the bone into abduction. Also, the teres major tendon can be transplanted posteriorly to provide lateral rotation when infraspinatus and teres minor muscles are paralyzed. Let's look at the teres major muscle. You can see this is the origin on the dorsal surface near the inferior angle of scapula. Then you can see here in phantom because it is inserted on the medial lip of intratubercular sulcus. Okay. See, labeled number 8. Number 8 there. Then the same muscle is this one. Number 16 is teres major muscle. Okay. Now, rotator cuff muscles. There are 4 of them. Okay, they are the 4. They include supraspinatus, infraspinatus, teres minor, not major, and subscapularis, also known as 6 muscles. That is supraspinatus, infraspinatus, teres minor, subscapularis. They are called the rotator cuff muscle because they form a musculotendinous or a rotator cuff around the glenohumeral joint. Okay, they are usually fused with the capsule of the glenohumeral joint. Okay, the tendon of the supraspinatus usually fused with the capsule superiorly. Tendon of infraspinatus and the teres minor fuse posteriorly, and that of subscapularis will fuse with the capsule anteriorly. Okay, and this cuff usually play an important role in stabilizing the glenohumeral joint. Now, the primary function of the rotator cuff muscles is to grasp the relatively large head of humerus and hold it against the smaller, shallow glenoid cavity. Remember, when we discussed about joint, we said that the stability of a joint is inversely proportional to the movements around that joint. Okay, and the shoulder joint can perform a very wide range of movement. So the movement, the range of motion of that joint is very high, hence the stability is very low. And you can see the head of humerus is not congruent to the glenoid cavity. So these muscles usually hold the large head of humerus against the shallow glenoid cavity. Now, supraspinatus muscle arises from the medial 2/3 of the supraspinous fossa of the scapula. Its tendon usually blends with the capsule of the shoulder joint superiorly, as I have said. It is inserted into a smooth facet on the upper part of the greater tubercle. Okay, it is supplied by the suprascapular nerve from the upper trunk of the brachial plexus. The muscle function is that to brace the head of the humerus against the glenoid cavity, the rotator cuff function. Also, it assists in fact, we say supraspinatus muscle is the one which usually initiate abduction. Okay, it's the one which usually initiate abduction. Then deltoid muscle, the acromial fibers take the other portion. Okay, let me take back the laser pointer. Okay, here it is originating here, supraspinatus fossa to be inserted into the greater tubercle, the highest facet or the superior facet on the greater tubercle. Here it is. It is supplied by suprascapular nerve directly from the upper trunk of brachial plexus. Now, infraspinatus arises from the medial 2/3 of infraspinous fossa and from the deep surface of infraspinous fascia, which covers the muscle. Now, there is usually a bursa which lies between the bare area of scapula and this muscle, and that bursa can communicate with the synovium, with the shoulder joint cavity. Okay. Now, the tendon usually blends with the capsule of the joint, and it is inserted into a smooth area on the central facet of greater tubercle. Okay, it is inserted into the central facet of greater tubercle. Now, remember we had said supraspinatus insert into the superior facet of the greater tubercle of humerus. So that is why supraspinatus is above, and you will see later that teres minor is inserted into the inferior facet of the greater tubercle. That is why it is with the tendon of teres minor below. It is supplied by also suprascapular nerve after supplying supraspinatus muscle. Action, apart from bracing the head of humerus against the glenoid cavity, it is also a powerful lateral rotator of the humerus. Here it is. Here it is. Okay. This muscle, you can see it here, it's discovered by fascia, originating here, inserted into the central facet. You can see this is where supraspinatus is inserted, the highest facet, then the central facet, and you will see here, this is the lowest facet on the greater tubercle. This is the greater tubercle of humerus. That is where teres minor will be inserted. Let's go teres minor. Now, it arises from an elongated oval area on the dorsal surface of the axillary border of scapula, or the lateral border of scapula. It usually passes upwards and laterally, edge to edge with the lower border of infraspinatus and behind the long head of triceps. Now, the tendon blends with the capsule of the shoulder joint to attach to the lowest, or the lowest facet or on the greater tubercle of humerus. Now, the lower part of the lateral border of this muscle lies edge to edge with teres major, but teres major usually leave the lower edge of this muscle of teres minor by passing in front of the long head of triceps. So triceps is like it intervenes teres major and minor. So teres minor lies posterior to the wrong head, but teres major lies in front of the wrong head or anterior. It is innervated by the posterior branch of axillary nerve. This is its function. I will say it again. It is also a lateral rotator and a weak adductor of the humerus. Also with the teres major, as we had said when discussing the action of teres major, it will hold down the head of humerus against the upward pull of the deltoid during abduction of the during shoulder abduction. Okay, here it is. You can see it is arising from an elongated oval area on the auxiliary bone of scapula, inserted into the lowest facet of the greater tubercle of humerus. And you can see here it is. You can see this is the wrong head of triceps, and you can see it is lying behind the wrong head. But you can see this teres major. First, they are lying edge to edge, but teres major will pass forward in front of. It will pass forward. It will go and it will pass in front of the wrong head of triceps. Okay. Now, subscapularis arises from the medial 2/3 of the costal surface of the scapula, and also from the intramuscular septa, which raises ridges on the scapular bone. Also, the tendon of the muscle is separated from a bare area at the lateral angle of the scapula by a bursa, which communicates with the joint cavity. Okay, so the subscapularis bursa usually communicate with the shoulder joint cavity. Now, lateral to this tendon, it will fuse with the capsule of the shoulder joint and it is inserted into the lesser tubercle of humerus, okay, not the greater tubercle. It's the only rotator cuff muscle isn't inserted into the greater tubercle. It's inserted into the lesser tubercle. Now, the muscle is covered by dense fascia, which is attached to the scapular bone at the margin of the origin of the muscle. It is supplied by the upper and lower subscapular nerves, which originate from the posterior cord of the plexus. Action is obviously a rotator cuff, so stability of the shoulder joint. In fact, is dynamic shoulder joint stabilizer. It will also assist in the fixation of the upper end of the humerus during the movements of the elbow, wrist, and hand. Acting as a prime mover, it is a medial rotator of the humerus. Okay. Here we can see it, see where it originates. Then here you will have a bursa which will be separated from the bare area of the scapula, and that bursa will communicate with the shoulder joints. Then it is inserted here to the lesser tubercle. Okay, here is the muscle. And maybe other pictures, you can see this is your rhomboidus major muscle inserted there. That is will be between the superior angle and the area where the scapular spine is inserted. Okay, maybe I hope you have seen the video on the muscles of the back. That is where I've discussed these the muscles like rhomboidus major, this muscle dorsi. Okay, so I think I've come to the end of that session, and before I leave, let me leave you with one quote. Whenever you feel like you are going through a difficulty, okay, remember that seeds have to be planted before they sprout. So you have not been buried, my friend. You have been planted, and soon you will sprout. Please subscribe for more anatomy and biochemistry content. Thank you.